Hello friends, and welcome back to the channel where we focus on staying strong, active, and pain-free, no matter your age. If you're over 60 and struggle with stiff knees, sore hips, or joint pain that makes walking or climbing stairs difficult, you're not alone. But the good news is, you can change that. Starting today. In this video, I'll show you the top 5 gentle, effective exercises that help relieve knee and hip pain specifically for adults over 60. And we'll also talk about surprising foods that might be silently harming your joints, and what you should be eating instead to support lasting mobility. So if you're ready to feel better and move easier, stay with me to the end. 1. Why knee and hip pain happens after 60. As we get older, it's very common to feel pain, tightness, or stiffness in the knees and hips. Why? Well, it's a mix of natural wear and tear, decreased muscle strength, and lower joint lubrication. After age 55, cartilage, that smooth tissue that cushions our joints, starts to thin. And when we're not moving regularly, the muscles around these joints weaken, which puts more pressure on bones and ligaments. The result? Pain when standing up, walking, getting out of bed, or even just sitting for too long. But here's what many people don't realize. You don't need intense workouts or expensive treatments to feel better. In fact, just a few simple, daily exercises can make a huge difference. Let me show you how. 2. Exercise number 1, seated leg extensions. This is a fantastic move to strengthen your quadriceps, the muscles just above your knee. Strong quads take pressure off the knee joint and support better walking, balance, and posture. Here's how to do it. Sit tall in a chair with feet flat on the floor. Slowly extend one leg straight out in front of you. Hold for 3 to 5 seconds. Lower it back down gently. Repeat 10 times per leg. Tip. If it feels easy, add light ankle weights. If it's tough, do fewer reps, but stay consistent. 3. Exercise number 2, standing hip abductions. This movement strengthens your outer hip muscles, which help keep the pelvis stable and reduce joint strain. Here's how to do it. Stand behind a chair for balance. Lift one leg out to the side, just a few inches. Keep your upper body straight, no leaning. Hold for a moment, then lower it back. Repeat 10 to 12 times per leg. This can ease hip tightness and help with stability while walking. 4. Exercise number 3, glute bridges. This move strengthens your glutes, the large muscles in your backside that support both your hips and lower back. Strong glutes reduce pressure on your knees and improve posture and walking mechanics. Here's how to do it. Lie on your back with your knees bent and feet flat on the floor. Keep your arms relaxed at your sides. Slowly lift your hips up toward the ceiling. Hold for 3 seconds at the top. Lower back down with control. Repeat 10 to 12 times. Tip. If this is too difficult on the floor, try doing a smaller bridge motion while lying on your bed. 5. Exercise number 4, step UPS. This mimics real-world movement like climbing stairs. It strengthens the thighs, hips, and calves, and builds functional balance. How to do it safely. Use a low step or bottom stair. Hold on to a railing or counter for balance. Step up with your right foot, then bring the left up. Step down the same way. Do 8 to 10 repetitions per leg. Safety tip. Go slow. Focus on control, not speed. If it causes sharp pain, stop. 6. Exercise number 5, heel slides, for mobility. This is a gentle range of motion exercise to help maintain flexibility in the knees and hips. Here's how. Lie on your back, legs straight. Slowly slide one heel toward your bottom, bending the knee. Then straighten the leg again. Repeat 10 times each leg. This improves circulation and helps joints move more freely, without putting pressure on them. 7. Transition to nutrition section. Now, movement is only half the battle. If you're doing all the right exercises, but still eating foods that cause inflammation in your body, you might be undoing all your progress without even knowing it. Let's talk about that. 8. Hidden foods that trigger joint pain. Certain foods can silently trigger inflammation in your body, especially around the joints. Here are 3 of the worst offenders for people over 60. 1. Refined sugars and desserts. Cakes, cookies, soda, even low-fat snacks. These spike blood sugar and increase inflammatory markers. 2. Processed meats. Think sausages, hot dogs, deli meats. They contain advanced glycation end products, AGEs, which are linked to increased joint inflammation. 3. Refined vegetable oils. Soybean, corn, and sunflower oil are high in omega-6 fats. Too much omega-6 can fuel pain and stiffness. You don't need to cut everything out all at once, but reducing these a little each day makes a real difference. 9. What to eat instead, anti-inflammatory foods. Instead, focus on joint-loving foods like fatty fish like salmon or sardines, rich in omega-3s. Colorful berries and leafy greens, packed with antioxidants. Olive oil and avocados, healthy fats that soothe joints. These help reduce inflammation, protect cartilage, and support healthy aging.